Hello and welcome everybody. This is Oral Surgery channel and I am Dr. Saif Ali At-Tamimi, and today we will show you a case of surgical extraction of impacted mandibular canine. As we can see in the panoramic view, the tooth should be on the left side, but it migrated all the way to the right side. The cross-sectional view shows that the crown of the tooth is buccally directed, and this will make the operation easier as the buccal side of the mandible is easily accessible than the lingual side. This is the preoperative intraoral photograph, and we plan to do a three-sided flap, doing two vertical releasing incision and connecting them with horizontal incision. This is the photo after flap flexion, and the tooth is already peeking out through the bone. Now we will start removing bone to expose the entire crown of the impacted tooth using surgical round bear and copious amount of irrigation with normal saline to ensure there is no heat generation. This is the photo after removal of the bone and exposing the entire crown of the tooth. After that, I'd like to do something called guttering using a surgical fissure bear. I create a space around the impacted tooth by going back and forth from mesial to distal on the buccal side of the tooth. This will create space for insertion of straight elevator and also will give a space for luxation of the impacted tooth. After luxation of the tooth, I usually cut the crown and separate it from the root. This is using a turbine and a fissure bear. Cutting the crown from the root, separating it from the root, will minimize the amount of bone removal needed for the extraction and also will protect the adjacent teeth from unnecessary trauma. This is the photo after separation of the crown from the root. From now on, it's a straightforward as the tooth is already mobile. Inserting an elevator adjacent to the tooth will luxate it and extract it very easily. This is the extraction socket immediately after extraction, and this is the impacted tooth. Finally, the suturing photograph. I hope you liked the case. Stay tuned for future video. Goodbye and good luck.